I am a hospice nurse and quality assurance specialist. I've been in home health and hospice for over 30 years with a couple of breaks in between. I've worked my way up from a field nurse to a nursing supervisor to a staff educator to quality assurance role that I've been in for the last number of years. Nursing is a very intense program, and it's going to take a lot of studying and a lot of work. And so you need to be able to understand how flexible the program is. They need to know about their faculty. What if, sometimes just because all these nurses have PhDs, but maybe they never worked a day on a floor or in any kind of clinical setting themselves doesn't make them the best teachers. Basically, get a good idea of the faculty and what are the clinical settings that they have available to them. How much time are they going to spend in the clinical aspects? And what other specialties besides hospital care are they going to offer in the program? All sorts of other kinds of things that can open their eyes to different aspects of nursing that they might want to go into. In home health, you have to kind of be a jack of all trades because you're out there on your own. There's not somebody down the hall you can run and grab and say, come help me. As a nursing supervisor, you're kind of the backup support over the phone for that person when they really get stuck or have a question or a problem. And sometimes, because we kind of cover a little bit of everything, you have to have a lot of self-confidence and you have to be resourceful, be able to maybe make something up on the spot. I mean, in the home, you may have to boil some water in order to clean off your instruments that you've just gotten really dirty doing something else, and now you have to do another aspect of care for your patient. The one thing I think it's important for a new nurse to remember is that, that first day or weeks or so, you're going to get a feeling that, oh my God, I've forgotten everything I've learned. But it will all come back to you. But, you're going to have to give yourself some time and be patient with yourself. Days are going to be very different than they were in your clinical studies. You may have only had one or two patients, and as a real nurse, you're going to have maybe 6 or even 8 patients. It could get kind of crazy, and you always have to be open to understanding that the unexpected thing is going to happen when you least expect it. It's going to be hectic. It's going to be crazy, and you're going to have a lot more patients than you think you can ever get through, and you'll find yourself there till all hours trying to finish up all your charting and all of your tasks and things, but it will get better. Well, we're in another horrible, tremendous nursing shortage, although to some extent you may not believe that because you nurses are having a hard time finding a job. But the economy's kind of dropped things back, so, hospitals are hiring, but they want experienced nurses, and they want nurses with more education. So they're looking for a BSN, MSN prepared nurses. And new grads out of an ADN program or even out of a BSN program are going to have a hard time finding a job right now. And so there still is a shortage of nurses. A lot of nurses have come back out of retirement because of the economy or have delayed their retirement. And that can be a challenge in itself because nursing is a very physical and emotionally challenging job. And, sometimes some of those older nurses need to retire. And so they can be a bit of a challenge to work with too. Hospice is a unique little area because we're helping patients at the end of their life. All of nursing is where I found is that, you have to kind of glean your own rewards. People aren't necessarily going to pat you on the back, or you're not going to accept an Oscar for your performance or anything. Watching a patient pass on and having the family be able to say their goodbyes and to have it all come together as a peaceful situation can be a really heartwarming situation for the nurses. You've got to be a compassionate person. You've got to be a patient person. And you've got to be wanting to provide and assist people, help people feel better, help them achieve better outcomes for themselves in a health setting. The media always kind of seems to portray nurses as being young little girls looking to find a doctor husband. And that's not necessarily going to get you very far in the nursing profession. This is hard work. It's emotionally challenging. It's physically demanding. And you've got to be ready to put in the time. Well, yeah, nursing has gotten to be a lot more technical in patient care, as well as the equipment and everything else that the nurse has, from using a smartphone or recent past PDAs. A lot of the nurses are still using PDAs. You have right there at your fingertips. Nurses are doing their charting in the hospitals on laptops and moving those with their carts and their meds and everything and stuff. You're reading a barcode now on the wristband so that you can identify that patient by that, in addition to other information they give you, so that we're reducing a lot of the errors with medications and procedures and things like that. So it's growing, and it's exciting. Teaching, which is where nursing is really going to go in the next few years, because with the healthcare reform and just in general the way the whole healthcare regime is going, nurses are doing a lot more teaching for patients, and that's going to be a growing role for nurses. And so we need to have a lot more tools and a lot more technology. One thing you need to know is that you're not going to learn everything you need to know from school. You're going to learn a lot of things on the job, and nursing is a lifelong learning experience. So you're going to be learning something new every day. The education process can be a very difficult one. You're not always going to have an opportunity to have every single procedure available to you. So you need to keep your eyes and ears open. If you hear of something that's going on the floor, let somebody know. I would love to be able to observe that opportunity. I'd love to be able to try to participate in that if it's possible. And be a sponge. Go out there and learn everything that you possibly can. You won't learn it all, but everything that you can possibly learn will aid you in some way. Nursing is probably one of the greatest professions that you can consider. And but there's always going to be that question everybody's going to ask you: why didn't you want to be a doctor? I always tell people, because I didn't want to be a doctor. I wanted to be a nurse. You have to understand what it is and why you want to go into it. But it's a wonderful profession, but there's going to be times when you're going to be tired of it and you need to walk away from it and maybe look at some other aspect. Where else can I go? There's a wealth of opportunity there, but too many nurses get stuck. There's a lot of other things that you can do. You just need to maybe look at a little different education, a little bit more experience, or, and ask for an opportunity. And I think a lot of people will give it to you.